Yeah, that's the other thing that has become pretty well known now. I work a lot with our pulmonologists because sometimes if they have a hard time treating some of these respiratory conditions, if you treat the reflux, patients' respiratory symptoms actually get much better. And it's probably because of the acid that actually goes all the way up the esophagus and ends up in the lungs and can cause inflammation there as well. But it's been pretty well studied now that if you manage the reflux symptoms effectively, you can actually improve not only reflux symptoms and the inflammatory responses in the esophagus, but also in the respiratory system as well. Yeah, I mean, I think, I had briefly mentioned, but the sort of the newest therapy for GERD is the endoscopic fundoplication. And this, I think, is exciting because there are certainly patients that want something more invasive, but that, don't necessarily want to go for something like a surgery. And this is a nice in-between for patients where they can have a more invasive intervention, but still being done all with an endoscopy, meaning no incisions from the outside at all. And this procedure, the transoral incisionless fundoplication, has been pretty well studied. I mean, there's been not only randomized control studies, but sham control trials. And the data is really exciting and promising. And I think it's certainly, more and more people are learning about it, and more people are interested in this type of procedure. And the other thing that I'll mention is that, in sort of in line with how everything is connected, there are certainly more people that are presenting with motility issues in the esophagus as well, where the esophageal muscles just don't contract properly and food has a hard time going down. And we're treating that more and more with something called an endoscopic myotomy, or a POEM procedure, which solves the problem of food being able to go down, but can reciprocally cause an increase in reflux, aka stomach acid, going back up once the connection is opened. And we've now started doing these endoscopic fundoplications for patients who are status post myotomy, and they've done amazingly well with this type of procedure as well. So it's an exciting new application for the TIF procedure, where I actually just published the first 5 patients recently this year, showing that 100% were able to come off their PPI medications, and all of them who had esophagitis recovered. So it's exciting how medicine, we're taking things and adapting them to other indications, and I think that's just going to continue to happen as we go forward.